Results really depend on the specific features of the cancer, the PSA, the Gleason score, the stage, and that information helps us filter in what are the best options between surgery, radiation, cryotherapy, brachytherapy, or what people call pellets or seeds. You know, for some hormonal therapy, and some it's just active surveillance where we don't think your prostate cancer is aggressive enough that you need treatment right now, but let's monitor it, defer treatment until we see that maybe the PSA is going up, repeat the biopsy, maybe there's more of the cancer there or a more aggressive one. So it really depends on the specific features of your cancer to really guide you down the road of what the best options are. For the earliest stages, you know, the Gleason score 6, the low PSAs, those types of cancers have the most options available. So surgery, radiation, cryo, and seeds. And in that category of people, all the treatments are equal long-term in terms of cure. So it comes down to hearing what the potential side effects are of each of those treatments to help guide you in decision-making. As we get into the more aggressive cancers, the higher Gleason scores or the higher PSAs, we kind of eliminate some of those options as not being enough treatment. So that can kind of filter the options a little bit more and, you know, rule in and out more accurately what the most appropriate options would be. Yeah, so as a general rule, and it also depends on the size of the prostate, you know, radiation and surgery are most recommended for a Gleason 7 prostate cancer. Effectiveness long-term will also depend on, you know, whether there's something on exam, how many cores were involved, but they're generally long-term equivalent in terms of success. Cryotherapy has been typically reserved for the Gleason 6 patients, mainly because, you know, the side effect profile is a little bit different, and because with surgery and radiation, you have the longest term track record of knowing, you know, 20 years down the road, its effectiveness. But having that frank discussion with your urologist in terms of, you know, what's the outcome based on, you know, your specific cancer, is cryotherapy a good option? What are the side effects? Or should you stay with either surgery or radiation? Yeah, especially for prostate cancer, because there's so many different options, it's really important to have a physician you're comfortable with, that you can communicate freely with, that's available, accessible, and can really go over all the different options and not try to bias you in one direction or the other. You know, breast cancer, we tell you exactly what to do. Lung cancer, same thing. So with prostate, you just have to be aware and make an informed decision on what's best for you. And having a doctor you're comfortable with, who's knowledgeable and accessible, can also help tease those options. Sometimes if your prostate is large, treatments like brachytherapy or the seeds and cryotherapy become less desirable, mainly because of the side effect profile, and that's where hormones come into play to help shrink the prostate and more amenable to those types of treatments. So even with hormones, you can get maybe, you know, a 30% reduction in the size of your prostate. So it doesn't always get you there, but if that's a treatment that you're really insistent upon, then that's the best approach to take to try to shrink it.
What are the side effects of the cryo?
Typically, as with most types of prostate cancer treatment, its effect on the bladder, and in the case of the radiation, also the rectum. So with cryo, you worry about urinary frequency, going more often, not having the same level of control of your urine. So sometimes you can get dribbling or leakage with it. And then sexual function is compromised at a high level with cryotherapy compared to some of the other treatment options.